I think that the two major things that we'll see in the NHS as a result of Brexit pretty quickly are challenges around supply of medicines and medical devices, and also various differences within the workforce. In terms of the supply chain, we know that there's potentially going to be difficulties getting some of the medicines over the border as quickly as we currently do. We operate with this just-in-time system, and the whole system is not set up for a scenario where lorries might be delayed at the border due to administration, perhaps due to regulatory issues, and the UK is having to plan quite carefully to make sure that we don't have any problems with the supply. But that is going to be an issue. It's being managed centrally at the government level. I think the other issue is workforce. A large proportion of NHS and social care staff come from within the wider EU, and the government has been working quite hard to make sure that there's good plans in place so that the people who already work here will be able to continue working here. Actually, the settled status scheme is currently open for NHS staff and all hospitals, other NHS organisations. It's incumbent on them to make sure that their staff are supported as well as possible to apply for this settled status scheme. In the longer term, then it remains to be seen what impact Brexit is likely to have on the amount of EU citizens who are choosing to come and work in the UK, whether that's frontline healthcare staff, whether it's researchers, whether it's social care staff, or of course their families as well. So I think that it's really important that all NHS employers are thinking at the moment of how do we show our staff that they're respected and valued, and make them want to stay and help them be able to do so. I think for finance directors, it's just important to be aware that Brexit is most likely going to have impact on the finances of your organisation. Even if that's just at the national economic impact level, moving on to things like medication companies that are currently having to pay extra for stockpiling, for potentially flying in drugs, for setting up duplicate laboratories in the EU and the UK. All these things that these pharmaceutical companies are having to do now, their investments could end up being reflected in prices of products going forward. Then we're looking at all sorts of things we can't quite predict, like exchange rates. It's also worth thinking about whether your organisation gets any financing from the EU. So for example, the government has guaranteed any research funding from the EU that has been secured by 2020, but beyond that we don't quite know, and it's not clear whether the UK is going to continue to get access to any sort of EU funding. So certainly if that is a source that your organisation depends on, then it's time to start thinking about how to cover that.